And then I'll post it up in the Facebook group. So that way, if anybody wants to double check anything or wants to follow along there, I'll post that when I'm on campus again tomorrow. Oh, well. Okay, so a few things that I wanted to review with you guys. I ran out of steam for the renal Magic School Bus, and I couldn't find my document. So instead, I'm just going to touch on some really, really important points for you guys in that renal system, and then I'll do that one as a new review coming up here. But I'm going to share the whiteboard and type some notes on here for you guys. So that way we get a little bit of practice. All right, so switch it over to text. There we go. All right. So a few things to review when we're going through that renal system. So just some things that I really was kind of surprised about, or things that I was learning about as I was reviewing this. There we go. The first one is CAS. And CAS, it feels like, is something that a lot of people have some challenges with. It's not always something that people are super comfortable with. So I wanted to review CAS, and what they are is made of protein. And it's going to be located in the renal tubule. So it comes from renal tubule. And we have 4 types of CAS. They are cellular CAS, which is going to include epithelial, which epithelial can come from, this is usually going to be skin cells. And this could be cells from parts of our organs. This could be something that gets potentially picked up in our cystocentesis. There's lots of ways to have epithelial cells showing up. We could also have leukocyte, which would indicate infection. We could have erythrocyte, which is, of course, our red blood cells. And that could be due to bleeding. Sometimes we could potentially have like leukocyte and erythrocyte CAS. Like if we have an infection, we can also see some blood too in some situations. Okay, so that's our cellular CAS. And this will be in situations of things moving through the renal tubules. This will be slow. So things are moving slowly through our renal tubules. Next up is I have granular. So granular CAS. This is when cells break down. And this will be slower. So things moving slower through the renal tubules. And this also will represent acute issues. So like acute renal failure, something that is happening suddenly, but it's causing things to move through our renal tubules slower. So we get the protein buildups. And the reasons why these are called CAS is that they are going to take the shape of the renal tubules. So taking the shape of the tubules, a cast is a casting of something, right? So it's going to be like a mold. So that's why they are called casts, is because it's taking a mold or a shape of those renal tubules. Next up, we have waxy casts. And so waxy casts are going to be additional breakdowns of materials in the renal tubules. And this is going to go into very slow. So we're going to have things moving extremely slow through the renal tubules. And this is going to indicate a chronic renal failure or a chronic condition where the kidneys are not working as well as they should. So basically, all of our casts are going to come from hyaline casts. And here is our next one. I'm going to put it up at the very top because that is where everything comes from. So we technically will have 4 subgroups of casts. We have 5 total casts. So I'm going to switch that to 5 types of casts. And all casts originate here. So all casts originate with hyaline casts. And so it's okay in our urinalysis to have occasional hyaline or granular casts. So if we have more than just occasional, then we're going to have problems. But normal will be occasionally showing up in your urinalysis. And this is when we're doing a urinalysis. And this will be our urinalysis of doing our there we go. Doing our microscopic examination. So we're going to take our urine, spin it down in the centrifuge, and then we're going to look at the sediment. And in the sediment, we can find the casts, we can find blood cells, you know, we could find crystals, we could find bacteria. There's tons of things that we're going to be able to find potentially in our microscopic exam of the sediment. And we need to be able to look at stained versus unstained. And each one will have different characteristics for how we want the light brightness. We're going to change how bright it is as we look at it under the microscope. But when we find those casts, having some is okay, having lots is not good. All casts come from hyaline, and then the other casts that we're going to have include the cellular casts, the granular casts, the waxy casts, and then we have one more, which is the fatty casts. And fatty casts are going to be basically fat incorporated in the shape of the renal tubules, so in the cast, and it's going to be instead or along with cells. So we could see cellular casts along with fatty casts. And one of the things that we commonly will see fatty casts with is diabetic dogs. And I don't have a speed for these ones. Usually this is where we're going to see, we usually will say that the cellular casts are going to be slow, granular casts are slower, waxy casts are going to be very slow. I don't have a speed for waxy or for fatty casts. So, all right, so I'm going to save this one as a PDF. And so I can include that in the PowerPoint for you guys, or I'll include that in the email for you guys as well. So I'm going to clear this one. Thank you for putting up with the very first time that I have taught casts. All right, next up, I did want to note just a couple brief notes on crystals. This is not a super long portion of it, but there are a few that I wanted to remind you guys of for crystals. Remember, anytime we have crystals in the urea, it's crystal urea. So crystal urea, crystals in the urine. Now, crystal urea can be an artifact when we refrigerate urine. So it is something that can show up and mean absolutely nothing if we refrigerate the urine. It also could mean something. So it may or may not have a clinical significance. So that's where I would say plus, minus clinical significance. Crystals that we can see include struvite, which are those coffin crystals. They're also called triple phosphate. Now, an important thing to note with our crystals is that they are often going to be influenced by the pH of the diet. So pH is influenced by the diet, and pH and diet will influence the crystal formation. So pH influenced by diet, carnivorous is acidic, herbivorous is going to be basic. So sometimes we can have diet, or many times when we have cats with crystal formation, if we have a diet that is tending to make their urine more basic, that's where we get struvite crystal formation for in our cats. And so this is going to be often, struvite formation is going to be our male blocked cats. And the reason why they block is going to be related to their anatomy mainly. So struvite is triple phosphate. This is going to be our most common crystal. We also have calcium oxalate, which is going to be antifreeze, also called ethylene glycol. We have calcium carbonate, which is not going to have a big clinical significance. Ammonium biurate, uric acid, leucine, tyrosine, and cysteine. These will all be in your Mosby textbook listing those, and also in your lab procedures. I'm hoping for next week that I'll have some pictures for you guys as well of the different types of crystals. So I'll have those listed in next week's review. So that way you have like just a little flip guide of the pictures and everything, because that's my next goal. All right. My notes here. Last one that I have for tonight for these is parasite ova in the urine. And there are two that we are concerned about in the urine. And the first one is Personnema plica, which is going to be in the dog, and Personnema felis cati. Guess which one that one is? Our cats. And this is going to be also known as the bladder worm. Also capillaria. Our other one that we are concerned about finding in the urine, usually we find the ova in the urine. This is going to be Dioctophyma renale. And that's going to be in the dogs. And this is going to be the giant, so AKA giant kidney worm. I'll have pictures of these guys next week as well. I'm awful at drawing on this, but basically what I remember from these is our Piersonema is going to have those end caps, and it's going to look kind of like the Trichuris vulpus, where we have kind of that roundish ova, and then it has the end caps to it. And then the Dioctophyma renale, the bladder worm, is going to have like multiple layers to it. And then they have that ova in the middle. At the ends, it has some bigger sections, not quite the end caps that we're used to seeing with our bladder worm, but the giant kidney worm then also has like little mottling around the edges here. So you have like multiple layers around the ova where it shows up. And this is just awful. Here is like my little drawings of it. So the very top one, you can see how it kind of looks like our whipworm, but it has little dots in the middle of it. And then here, similar shape, but it's going to have multiple layers around it. And then it has bigger little sections of end caps on the end. And then it has really pretty like stitching around the edges. So I'll have those for you guys next week with pictures as well. So crystals, bacteria, and then the parasites that we're typically going to be seeing in our thing. So I have our whiteboards saved, and I'll send those along to you guys as well. Clear that and stop the share there. All right, and then I will share our animal care and nursing. Oh, one other thing I wanted to share with you guys, I remember now. Wanted to remind you guys about our CRIs, because nobody loves them, but we got to love them at least temporarily, right? So I'm going to do one more. And this is from a textbook that a doctor friend of mine wrote that I really, really like on math. And let's see, go back to the whiteboard. Text. All right, so CRI, these are going to be the information needed. So when we are working with our CRI, the very first thing that we're going to need is our patient's weight. And this is typically going to be in kilograms. It may come to you in pounds, and then we have to divide by 2.2 and convert it to kilograms. That's always a possibility. B, we need to have the drug CRI dosage. And this is going to often show up to us in our mgs per kg per hour. Could also be in mgs per kg per minute. Could also be in micrograms. Micrograms or MCG also might show up as appearing like UG, where it looks like a U, it's the mu. So that can also be part of it too. So it can show up in micrograms as well. Keep in mind that micrograms are going to equal, it's going to be 1,000 micrograms is equal to 1 milligram. Or with our micrograms, it'll be 1 million micrograms in our kilogram. All right. So these can show up as micrograms per hour or micrograms per minute. The most important thing for us with these is to make sure that our math is matching. So if you need to have milligrams per kilogram per hour, then we need to make sure that the patient's weight matches. We need to make sure that our drug concentration matches as well. So my biggest worry is usually just making sure that all my units are going to match, so that way I can do the math later on. So C is going to be the drug's concentration. And drug concentration is going to be in either mgs per mil or micrograms per mil. All right, and then D, we sure have a whole bunch of these. We need our volume of fluids. So how much is in our fluids bag? And this will need to be in milliliters. They may give it to you, uh-oh, it froze. Okay, there we go. They may give it to you in liters. So may need to convert liters. And in that case, you know that it's 1,000 milliliters in 1 liter. So we would take our liters and divide by 1,000 to get to milliliters. No big deal. And then E, this is our last one. This is going to be the desired total fluid rate. And so this will usually be showing up to us in mils per hour. And then there are a couple of different ways that we can calculate these out. There are formulas where if you identify each of these things, then you can just plug into your formula and do the math. We're running low on time here. The formulas are going to be in the common veterinary math packet that I sent out last week. So all you have to do is open up that packet and you can find those formulas. Remember, when we do sign you up for Vet Tech Prep, they give you lots and lots and lots of math problems, and they give you lots and lots and lots of solutions. And so if you hit a point, especially for my newer people here who are going to take the VTNE this summer or later on in the year, if you hit a point where you are like, how the heck did Vet Tech Prep solve this? Because Vet Tech Prep always gives you the solution and you're like, oh! Remember that if you want a very fast response, they do have at the bottom a ask the expert, and you can click on that and ask them for help with certain problems. Also, if you want a slower response, you can always let me know what it is, let me know the solution, and then I'll be able to help go through it with you at a different point. I can do it after VTNE reviews. I can set up a Zoom time with you. Later on in the week, you can always pop into my study hall as well. I have study halls on Thursday afternoons from 12:30 to 2:30 in my Zoom room, which you are in my Zoom room, and you can always show up there as well. But you can always feel free to text me if you're having problems with certain problems, and I'll be able to help you go through those. So, you know, it just might take me, I always like to be able to look at it ahead of time so I'm not bumbling my way through these problems, because, you know, sometimes I have brain tiredness and I need to go through it and make sure that it makes sense to me before I can attack it with you. So I'm always happy to help you with that stuff as well. So I've saved our CRI problems, the information needed, and I'll include that as well. I'm going to clear all the drawings, stop the share here, and then I will pull up our answer key from this week's review and share that with you guys. And then at the very, very end, I'm happy to take questions if you have any questions for anything. There we go. All right, make this this a little bigger for you guys. Let me know if you can't see the answer key. All right, so this one was just a really interesting one that I found that I was like, oh, I did not know this. And it has some really good links to follow as well. So you can click and hit control and click on the link, right click on the link, and it opens up the information to you guys in a different window. So how long after booster rabies vaccination in dog, cats, or ferrets is it considered to be currently vaccinated and protected against rabies? And that's actually immediately. So after the first vaccine, it's considered 28 days. But if we are boostering the vaccines, it is considered immediately protected, which I found really interesting. So local health departments, though, can have some variations. I found a really neat website that if you just Google state laws for rabies in cats, about half of our states require rabies vaccines in cats. Arizona, of course, does not. There's lots of really interesting information about rabies out there. So basically, with all of our rabies exposures, we have two questions. Who is involved? Is it an animal to animal, or is it an animal to human? And was the animal vaccinated or up to date on its vaccines? And so then we have high risk versus low risk. If it's wildlife, it's something that we will usually have to euthanize the animal and send it into the state lab. Vaccinated versus unvaccinated pets, we have different amounts of quarantine time periods and monitoring. And if the animal ever shows neurological signs, then it's something that often will get euthanized and sent to the state lab as well. Because of course, remember with rabies, we have to take brain tissue, and it's not something you can take while the animal is alive. It's unfortunately got to be tested while the animal has been euthanized. And then there's a whole bunch of information also on post-exposure vaccinations and things like that. So there's lots of different animals that of course can become rabid, and our vectors are the big ones to be worried about is our bats, raccoons, and skunks. In Arizona, foxes are another one that is a concern. I know there's a lot of media out there on opossums that they can't catch rabies. That's not true that they can't. They're just lower risk amongst our wildlife. If we ever see a bat on the ground, we want to make sure that we do not touch it with our bare hands. Work gloves or scooping it into a shovel or something like that is very important. There are downed bat protocols at many of the schools, and it's basically we do not touch it. We call someone who can do that, and we never pick up a downed bat because the risk is just so high. So, all right, number 2, which species are induced ovulators? Our induced ovulators are our cats and our rabbits. So it is going to take copulation, or sex basically, for our cats and our rabbits to be able to ovulate. So remember, copulation is a very good vocabulary word because not everybody knows what it means, and it turns out to be kind of an important word when you're taking your VTNE. So there is also a great table here of reproductive features. Most of these will link to Merck Veterinary Manual. These are questions that come from Zuku Review, and you can get the daily Zuku Review emails sent to you as well. I have a whole bunch of links on different tests and different reviews and resources that are coming up here. I think after next week, let me look at my calendar. I think we have one more week of finishing this, and then we start back on our week 1 of VTNE practice. I think starts on, let me pull up my calendar because I don't know the dates right now. Calendar. All right, so today's the 10th. The 17th is our last one for this testing cycle. And then starting on the 24th, we will start our brand new VTNE testing window, and we'll go back to the beginning of vocabulary, terminology, A&P, all of that good stuff. And then we will be off on the 31st because of Memorial Day. And then after that, we will continue weekly until, you know, whatever our next holiday is. All right. Number 3, what is the function of the gizzard in the chicken? And this is going to help us with the muscular digestion. It is going to replace the function of the teeth, because chickens have beaks, they do not have teeth. And so that gizzard, we have our ventriculus and our proventriculus. The ventriculus is going to be the gizzard, or the muscular stomach, which will help with our digestion. It'll contain grit, small rocks. The crop also can hold grit and small rocks to help with that as well. And then the proventriculus will be the true stomach of the birds. And that will help with the acidic digestion, mechanical versus chemical. We have our chemical digestion happening in the true stomach. And so there's lots of good information here, different links going to the Merck Veterinary Manual, and some good images for you guys to check out. Rats are going to lack which abdominal organ? And that's going to be the gallbladder. Our charlottes lack the gallbladder, and horses lack the gallbladder as well. So rats, charlottes, and horses do not have gallbladders. Number 5, barbering in mice is when one mouse overgrooms the hair of its cage mates. And barbering is going to be a behavioral issue. Usually it's going to be related to a dominance problem with our rodents. Which species is predisposed to seizures? And that's going to be gerbils. Gerbils will break into seizures due to stress or high temperatures. And in some cases illness, but it's not as common to have illness in these guys as our other species. So stress and temperature extremes. What is the common name for the hamster disease proliferative ileitis? And that's going to be wet tail. Basically, they have so much diarrhea that they're going to, unfortunately, have that wet tail area. Now, hamsters do not have big tails. They're just going to have a little nubbin. So that whole area around their hind end will be completely wet with diarrhea. Number 8, which species, if gets picked up by the tail, is predisposed to easy degloving? And that's going to be the gerbil. Gerbils are not meant to be picked up by the tail. They're very delicate tissue that basically will just pop apart. It's awful. I swear that every person in veterinary medicine has some kind of traumatic gerbil or hamster story of some sort, you know. Which of the following bedding would be recommended for our hamsters and gerbils? And that would be the shredded paper is usually the most popular and most recommended, even if it is not the cheapest. Cedar shavings are really bad because cedar is not good for the lungs or the liver. The oils, the aromatics can make the animals very sick. Peat moss is going to hold a lot of humidity, which is great for other species, but for our rodents is not a good choice for them. And then sand, likewise, sand looks really awesome, and I've seen some hamster habitats made up with sand, but it's not as the absorption is not as great as the shredded paper, or even like the aspen bedding is still a little bit better. Number 10, which vitamin must be extra fortified in guinea pig diets? And that's vitamin C. Guinea pigs need to have supplemented vitamin C. Our primates, non-human primates, human primates, and our guinea pigs cannot make vitamin C on their own. They have to get it in their diet. Which species has hypsodontic teeth? And that's going to be our rabbits. Hedgehogs are going to be insectivores, so they're going to have those like separate incisors in the top, and then their bottom incisors will fit right in between that, so that way they can behead their insect diets. Ferrets are going to be carnivores, obligate carnivores, and then pigs are going to be omnivores. So rabbits are our only hypsodontic critter, and remember that hypsodontic means continually erupting. And we have different types of hypsodonts. There are radicular hypsodonts and aradicular hypsodonts. More information on that is in the dentistry chapter of your Mosby textbook. And basically it's just which teeth are going to erupt. And so like our ruminants are going to have different teeth that erupt from our rodents or our rabbits. It is normal to find crystals in guinea pig and rabbit urine. So they naturally do produce crystals in their urine. Some of it is discussed that they don't get enough activity, and so we can get very sludgy urine. It's kind of like how salad dressing works, in that the solids of salad dressing sink to the bottom, and we can end up with crystals and in some cases even stones in the animals that don't get enough activity. Whereas if we shake up our salad dressing, like I'm thinking Italian salad dressing right here, how it separates out and all the solids go to the bottom and the oil goes to the top, that's what we're finding often with rabbit and guinea pig urine, is that animals that have more abilities to run and jump and play and be active have the more shaken up salad dressing in their urine. And so it means that they're able to void the crystals and everything much better, and it's going to be much more dilute than if we have them just kind of sitting around being, you know, being caged potatoes where they don't get to move around a whole lot. Number 13, female guinea pigs should be bred before the age of 6 months. And that's because the pelvic symphysis fuses, and we can have dystocias for pregnancies thereafter where the babies may not fit. 14, when handling rabbits, the hind limbs must be supported because of the risk of posterior paralysis. Rabbits can kick so hard that they can break their backs. And so we are worried about them being able to harm themselves so much that they have to be euthanized. Number 15 is your patient is a 6-pound rabbit that needs fenbendazole to treat E. caniculi at a dose of 5 mg per kg. The concentration is 100 mg per mil. How many mils should we give our patient? We need to take our 6-pound rabbit and divide by 2.2 to get to kilograms. So 2.72 kilograms times our 5 mg per kg. And that's going to give us 13.63 milligrams, which then we divide by our concentration of 100 mg per mil, and we get 0.136, which rounds up to 0.14. Number 16, our rabbits, horses, and rats lack the ability to vomit. Rats do not have a center in their brain that controls vomiting, so they are just unable to do that. They also have what's called the limiting ridge, which is the anatomy in their stomach that basically it pinches around the esophagus and keeps things from coming up. How long should rabbits be fasted prior to anesthesia? Our rabbits do not need to be fasted prior to anesthesia. They have very fast metabolisms, but also can't vomit, so that helps. Atropine is not a good choice of anticholinergic drug in rabbits because many of our rabbits are going to have the enzyme that degrades atropine, and that's called atropine esterase. So that enzyme will be naturally produced in about half of our rabbits, and means that atropine is going to get broken down and will not work as effectively. It still may work, and we may need to dose it at higher doses, but we need to usually dose more atropine in those cases, or we could use glycopyrrolate. Red leg is going to be a bacterial disease, and so here is the bacteria for red leg, and that's going to be Aeromonas hydrophilia. Amphibians have the renal portal system, and that means that the location of administration is vital. We need to give our medications in the front half of the body rather than the back half. If we give them in the back half, it means that it gets taken out of circulation, goes through the kidneys or goes through the liver, and that can be too high of a concentration for those organs. If we give it in the front half of the body, it goes through the systemic circulation first before getting removed, and so then it should hit the target tissue. 21, the common human viral disease that is contagious to ferrets. Well, could be rabies, could be COVID, could be influenza. So our ferrets are susceptible to rabies, COVID, and influenza. I'm more concerned for your VTNE about influenza or rabies because, you know, more current information usually takes its time to make it into the VTNE. 22, like we talked about with dentition, our ferrets are going to be strict carnivores. They need to have high protein diets. Ferrets that have symmetrical hair loss along the shoulders, back, abdomen, and rump are going to be exhibiting. It's not mites. It's not behavioral. It's going to be adrenal gland disease. So adrenal gland disease will often cause muscle wasting, hair loss, and it'll even have the females showing signs of heat, even though they are already spayed. There is medications like Lupron that can be administered to them, or we can do surgery on the adrenal gland above the kidneys to help fix that problem. Most commonly, Lupron is going to be the most affordable option for our ferrets. Which disease should ferrets be vaccinated for? They should be vaccinated for canine distemper and rabies. So while we can't catch distemper, we can catch rabies, but they can catch distemper commonly through unvaccinated dogs. So it's not a good idea to walk an unvaccinated ferret on sidewalks or to the dog park or anywhere where we could even track it in on our shoes in some situations. So that is a big concern. Balis ascaris is going to be a parasitic zoonotic nematode of chinchillas. It can be in any of our small rodents and mammals, and is often picked up through contaminated feed. How more do I have here? Not too many more. Hedgehogs are classified as insectivores. Chinchillas must bathe in dust. That's going to keep them from having dermatological problems. 28, the zoonotic bacteria carried by many reptiles, birds, and even hedgehogs is Salmonella. Our reptiles need exposure to UVB radiation in order to absorb calcium in their diet. So UVA is going to be behavioral, UVB is going to be reproductive, A is behavioral and reproductive, UVB is going to be dietary. So in order to have a good phosphorus to calcium ratio, we're going to need to supplement them with ultraviolet light. Number 30, why can't you use an intraosseous catheter in a bird's humerus? Remember that pneumatic bones are going to be the long bones that are going to be closest to the trunk of the body. So the humerus is a pneumatic bone. So we would rather do the radius and ulna or the tibia fibula, not the long bones closest to the body. And also have a note here, right jugular always. For our exotics, we're almost always going to focus on the right jugular. We find that birds do not have a well-developed left jugular vein. Right jugular is important in our pigs as well because we have the phrenic nerve on the left side, which we can cause respiratory issues if we hit it in the wrong place. So right jugular, same thing with our reptiles. We want to make sure that we're going right jugular because the left side will be often smaller or hard to hit. Top half of the chelonian shell is called the carapace. Remember, the bottom is the plastron, and each little segment is going to be a scute. Common diseases of our small mammals. Slobbers is going to be malocclusion. Scurvy is going to be hypovitaminosis C, hypo, low. Lumps is going to be cervical lymphadenitis. Snuffles is Pasteurella. Wet tail is proliferative ileitis. And pododermatitis is also called bumblefoot. As far as incisors go, keep in mind that our rats, hamsters, and guinea pigs have 2 pairs of incisors, top and bottom, 2 teeth each. But our rabbits will have 3 pairs of incisors. They'll have 2 on top and 1 on the bottom. So 2 teeth on the bottom, 4 incisor teeth on the top. So rabbit dental formula is important because you need to know the peg teeth. All right, almost there. We have a 500-gram rat, and that is going to weigh 0.5 kilograms. 500 grams divided by 1,000 grams in a kilogram gives us 0.5 kilograms. Our 1,000 gram guinea pig is going to weigh 1 kilogram because 1,000 grams in 1 kilogram. A 0.75 kilogram guinea pig is going to weigh 750 grams. We have a guinea pig that weighs 1,000 grams, and we need to give it meloxicam, the NSAID, at a dose of 0.5 mg per kg PO. The concentration is 0.5 mg per mil. Keep in mind that meloxicam has multiple different types of concentrations, so we make sure that we are grabbing the right bottle. 1,000 grams equals 1 kilogram, and 1 kilogram times half a milligram per kilogram gives us 1 times anything, gives us that number. So 0.5 milligrams divided by 0.5 mg per mil gives us 1 milliliter that we would give PO. We have our fish here with white spot disease, which is also called ick. Ichthyopteris multifilius is going to be the full name for it, but we call it ick like ICH, but it sounds like it's icky because it is. And so this is going to be a parasitic disease that we will need to treat our poor fish because it could lead to death. If we're trying to determine the sex of our rodents, remember that anogenital distance is important. We want shorter anogenital distance for our females, longer anogenital distance for our males. And remember that female rats will have nipples, male rats will not have nipples. So there's another picture there, and that is it for tonight. Whew, just finished at 9:03. All right, stop the share.